And it's my great pleasure to introduce my friend and colleague, Donna Skoda. Donna Skoda is the Health Commissioner for the Summit County Public Health. She's worked in community-based public health programs for over 25 years, and her current responsibility is to oversee the management of our health district, including assessment, epidemiologic components within the health district, data and data information systems, and general strategic planning for the health district in the community. As you can imagine, in this pandemic, Donna Skoda has been working tirelessly. And I've been able to work collaboratively with Donna through other projects, even back to the days when we had Ebola in the community, or potentially had Ebola in the community. So I've seen her in action over the years, and she's quite accomplished and very capable, and a great community partner, at least for us at Akron Children's Hospital. She was previously employed in Cuyahoga County for 15 years, implementing community-based programs in areas of nutrition, which is a concern of our Rotary International, and other areas of public health. She is a registered and licensed dietitian with a master's in public health and nutrition from Case Western Reserve University. Without further ado, Donna, please take it away. We look forward to hearing your remarks.
I don't think she realizes she's muted. Donna?
All right, I'm sorry.
That's
You'd
all right.
think after doing my 1,497 Zoom call, you'd think I would remember to unmute. Yeah, not really. But what I was saying was thank you for having me. And what I hope to do is I'll talk about some numbers, talk about some trends, and tell you where I think we're headed and where I think we're going, what we're going to see. Today, we have confirmed in Summit County 4,965 cases of COVID-19. Unfortunately, we have also seen 249 deaths. And early on, our deaths, about 178 of these are associated with a long-term care facility. A person was either in a long-term care facility and released and/or. So we've had a good majority of our deaths, unfortunately, tied to long-term care. This novel virus continues to disproportionately affect minorities and within Summit County, and those also that suffer from the social determinants of health, meaning those that live in substandard housing, those that have less access to resources, and those individuals that probably work on the front line in most of our lower paying positions. And that is who we have seen the bulk of the cases. Long-term care early on was our first experience with the COVID-19 virus. And what we saw from that were a lot of, when it first hit, no one knew what to do in those facilities. And now I can tell you without a doubt, they are very good at managing COVID-19 within facilities. They have learned how to manage it, how to manage staff, appropriate PPE. If you remember when this all started, we didn't have adequate PPE, and we also were short on testing and testing supplies. So, and we still aren't in a good spot with testing, but to be honest, the PPE is seemed to have corrected, and we have put in place some programs that allow for regular testing of long-term care facilities. So we are seeing, in fact, a much better management of COVID-19 within facilities. Overall, COVID, I hear a lot of, as you can imagine, we hear it all, as I'm sure many of you do. We've probably had 7,000 complaints since March. We've had over 7,000 complaints. And most of them relate, or some around that, you know, this isn't really real. This is just like the old SARS. But I have to be honest with you, this is not SARS-CoV-1 that we saw. in 08, 09, this is not the same disease. SARS-CoV-1 came to the United States. The 39 or 40 cases we had in the United States were related to travel. It lasted about 5 months. I think there were, if I remember correctly, there were about 8,000 cases, and it went away. This novel SARS-CoV-2 is not going away, and it certainly has not let up at all. In fact, I just received the CDC notice that the United States has exceeded 200,000 deaths. And I can tell you, to put it into some perspective for you, we would say that a really bad flu year, about 36,000 people died. So we're looking at, 5, 6 times that, almost 7 times the death that we would normally see from flu. So where we have been in this is trying to control the disease through any number of strategies. Certainly the governor early on closed things, trying to help do disease control, and slowly we have reopened and we have seen that resurgence. What we're trying to have is for individuals to remain socially distanced, stay away from each other, wear a mask, wash their hands, those sorts of things, in order to prevent spread. And I can tell you that in Summit County, we've done a really good job of controlling some of the spread. However, every time you reopen anything, you're going to see spread because it's very, very communicable. You're going to see this disease spread. The problem with this COVID and the spread is that it is a novel virus, and therefore we don't know everything we need to know about it. And one really very difficult part of this pandemic is we don't know who gets really sick. And that's where it's been tough. We've had really young, healthy people get really sick and end up intubated and hospitalized. And many of you may have been reading the literature around the number of individuals that continue to have secondary effects from COVID long after their recovery period. And we're also seeing a lot of information and collecting data on individuals trying to determine, yes, in fact, what are the long-term effects of COVID-19? Is it neurological? Is it your heart? Is it whatever? But we need to figure out just exactly what does happen with individuals long-term after surviving COVID-19. You may also, let me just talk for a minute about testing. When this hit in March, February, March, if you remember, it started in Europe and in the Asian countries, in China, and it spread across the world. Well, many of the swabs that were used for this NP swab are made in Italy. So there were shortages immediately. Some of the reagents that were used for the testing were made in China. So immediately there were product shortages for testing. So we didn't have enough swabbing kits. We didn't have the test supplies necessary to be able to test. And the reason you want to test early on in a pandemic and in disease is if you're testing, you can then immediately isolate and quarantine. And you isolate somebody when they're ill, and you quarantine people when they could possibly be ill. So we have been trying to catch up on that testing, and it's been difficult. So we're testing in response to congregate outbreaks. We're testing in response to any number of unique living situations, like a jail and or a developmental disability, a home for individuals with any sort of chronic illness or disability. And so we're trying to do that congregate testing for disease control. We're trying to do some general testing in the community. We've done some stand-up testing, but as this has progressed, we are now on the other end of it. We have plenty of testing supplies, but what we don't have right now are lab capacity. we don't have enough adequate lab capacity to be able to run all of these tests. So I can go out and swab noses till the cows come home, but the bottom line is I don't have enough of the lab capacity, and that's across the country. And that started to turn south when Texas blew up and when Florida and Arizona and some of these larger, more densely populated states with lots of cases, California, a lot of the supplies then went there. So we continue to have to be sort of frugal with the testing that we do have available and are continuing to try to do additional testing. It gets a little more complicated for everyone with the kinds of tests that are out there. I know some individuals just want to know if they had the disease and they want to go get an antibody test. Well, some of those are good, some of those aren't so good. It's buyer beware if you're doing an antibody test, because it's not 100% anywhere. Most of them don't have any really official FDA approval. There's also the antigen test, which is great. It's a quickie test. But if you're positive, you still should have the molecular PCR test to confirm that you have the disease. If you only have the antigen test, we are required by the state to enter those as probables that you might have COVID until we get that confirmatory PCR test, meaning that yes, in fact, you really have the disease. But the good part about an antigen test is if you're negative, you're pretty sure you are negative, which is good. But so testing again, and we're trying to purchase through the state some quick testing. We do some testing for schools because children, there has been some shortage of children being able to get tested. And so we are in the process, we have set up with the school districts that we can test, trying to get kids back in school quickly, and we can test their staff and try to make sure that no one has to stay out of school longer than necessary. Because, you know, kids can have all kinds of crud, and so can the teachers. I mean, kids can have, you know, any sort of cold, cough, sneeze, whatever. And so we really do want to try to decipher that quickly so we can keep kids in school and let them continue. Now, when you start to go to older kids, college kids, it gets more complicated. The more freedom you have, the more complicated things get. And so we have had some difficulty with sports. We've had some difficulty with college parties, campus parties, where we have seen communal spread. And right now in Summit County, one of our biggest data points, and I was going to talk a little about the data, but one of our biggest data points right now is the amount of community spread that we currently have. About 90% of all of our cases right now come from just somewhere random in the community. They're community spread. They're not from long-term care. They're not from any sort of congregate setting where people are together. They're not from the workplace, but they're just coming from general community spread. And I have to tell you, even when you look at youngsters in schools and you look at the university setting, our problems have not been with kids in the daily like school. I think it was Christina who said that, you know, her children are back in school and they're doing everything they humanly can to keep them safe. And I can tell you that is true. We have worked tirelessly and endlessly with the school superintendents all summer to come up with plans to put kids back in school. Where we're having trouble is the after school activities. The kids are now thinking, oh, school's back in, everything's fine. But I think what you have to realize is if you're choosing to go to school, then you should not be choosing to do other activities as well. Every time you engage in a different activity, you increase your risk. So it's good for individuals to measure their own risk and decide, am I going to go to the grocery store this week? Am I going to go to the hair salon, whatever? But you have to remember, every time you add on a new activity, you increase your risk. And that's what we're seeing. So we're seeing families who think, oh, the kids are back in school now, they can have a sleepover. No, you shouldn't do that. Don't do those kinds of things. And the other problem we're really having is with family gatherings. And it's because when you get around your family, and you might not live with your family, all of them, but you live with part of them, and they're very familiar people to you. So the only people that are in your bubble are the people that sleep in your house every night. Nobody else is in your bubble. So if you invite your extended family over for a party, you should still wear masks, stay 6 feet apart, stay outside, and don't. What we're seeing is when families get together, larger groups of families, they start to let their guard down because they think, oh, Aunt Betty can't possibly have COVID, so off comes the mask. And they start talking. And before you know it, somebody who came into their bubble did have COVID, and it spread all around. You can also, I want you to be aware that there are about 40, up to, the literature says up to about 40% of all COVID cases that are asymptomatic. And I can tell you, I've talked to a lot of people on the phone doing interviews, and they have said, oh, wow, I was surprised I was positive. I didn't know I had it. I just didn't. And, oh yeah, I had a headache one day. So the symptoms are very different. So staying away from each other is very important. Now, let's talk a little bit about trends, because I want to leave time for some questions, and we can have a discussion. But every week, we put out what is known as a long-term care report, which reports all long-term care to the state, any sort of number of cases, information regarding any congregate living setting. We also put out one now for the schools, which is very helpful. It's on our website, and it talks about trends, and it tells you whether our indicators are increasing or decreasing. And the ones we really watch closely are the case rate. So if we have cases greater than 50 per 100,000 residents over a 2-week period, that will make that indicator positive for us with the state. And that's how you end up getting that red, orange, yellow designation. The other indicator that we pay very close attention to is how many of our cases are happening outside of long-term care. Are those cases that indicate community spread. We also look at the number of sustained ER visits. You know, for over a 2-week period, we see that sustained ER visit for the treatment of COVID-like symptoms. And we also look at the sustained hospitalizations. So how many people end up going in the hospital and staying there and then end up intubated. We also look at the number of children that become ill, and we're monitoring the number of kids that actually contract the disease from those extracurricular activities, dance, sports, cheerleading, whatever that might be. And we also then look at the number of children that eventually would end up hospitalized, which I can tell you is not a whole lot. Our numbers have been very good in Summit County and have been very low. And I liken that to the good compliance we've had. I think families have really done a nice job teaching their children to wear masks, stay 6 feet apart. And so when I look at trends, we're at just like a steady holding pattern. Back in June, we got down to about 10 to 15 cases a day. Right now, we're tracking somewhere between 35 to 50 cases per day. So we're right at that sustained trajectory. And we're just hovering there. Every once in a while, we'll get a banner day, but not really. We've done some community testing, and when we've done that, our positivity rate from our numbers is about 5%. We would like that down much lower. We would like that at 2 or 3%. I can tell you school districts around the world that have successfully opened have seen positivity rates as low as 0.8 and 1.8. So, I mean, if you want to stay open, we have got to keep vigilant with the masking and keeping everybody socially distanced and make sure that they stay away from each other. The last thing I want to talk about is vaccine. This is where through this whole thing, I never really wanted a crystal ball till right now. But I wish I had a crystal ball to know about vaccine. But I can tell you from everything I've read and with conversations with the state and CDC, a vaccine will not be our cure-all and end-all. We will still have to be extremely careful for some time. A vaccine will help. It's been likened to that of a flu vaccine that works, you know, a good vaccine on a good year, 50, 60%. We're happy with the match, but you have to understand these little bugs called viruses are very good at surviving, and they find lots of ways to survive. So they mutate and change forms and become different. And so has COVID-19. So a vaccine, we're hoping, will give at least 5 to 6 months of coverage, and that we're hoping that people can get, but you're still going to have to be vigilant for quite some while until we get this thing totally under control. And I know it's been very difficult for people, and I think it's been, we all got, I liken it to the day I woke up and dropped into an alternate universe, because that's what it feels like most days, because you just have to think before you do things. But I can assure you every day it's getting better, and we are going to get through this. It's just going to take all of us working together and doing every single thing we can to control the virus. The first thing you should always ask yourself before you do something is, what risk is this? Because activities are not without risk these days. And so hopefully we won't have a bad flu season, I'm hoping. I can tell you that in the spring, we usually see a spike in flu. This year we didn't see it because COVID killed the flu, basically, because people covered up and stayed away from each other. So we never saw that second spike in flu, which we were very happy about. So I'm hoping this year that we will have a very similar situation. The only difficulty we're going to run into is you use the same supplies for the flu respiratory panel that they do, and which could lead to supply shortages. But other than that, it's very difficult to differentiate between flu, COVID, H1N1. It's just tough. And so it's going to be hard to sort out exactly what people have or don't have. So with that, I will end, and I will be glad to entertain any questions or discussion.
All right, thank you so much. We appreciate it. Guys, questions, the floor is open. I'm monitoring the chat room. Okay, so Jan Rattle has a question. How has SCPH addressed the COVID-19 breakout among Akron's refugee community? Are their employers cooperating? Just curious about that.
Yeah, well, there's a couple things there. The majority of our Asian refugee, Nepalese, Bhutanese live in North Hill. Many of them work in frontline manufacturing, meat packing, any number of jobs. They ride to work together in vans, which is about an hour ride. And so there's been some debate between what the newspaper prints and what the individuals say happened. So basically what it's been doing is looking at, yes, there's been, in fact, we have about 4 to 5, maybe 4.5% refugee, I would say Asian population in Summit County, and they've made up about 17% of the cases. Many of those individuals work in these frontline jobs, but they live in multi-generational homes. So there can be 10, 12, 13 folks living in one home, very crowded conditions. So the spread is very easy, happens. So yes, we have identified via the employment, via the transportation, via their living situation, higher cases of COVID-19 among that population. We have done specialized testing. We have done outreach through their faith leaders, and have tested repeatedly that community. When we picked the Chapel Hill area for our last testing event, one of the reasons we picked that area was 44310, which is that zip code, was close. And so, yes, we've been addressing that on an ongoing basis. We have seen it getting better. But again, these individuals work and live in situations that really do promote the spread of disease. So, but I have to tell you, when we translate the documents, we work through their faith leaders. They do a really good job once they understand what needs to happen.
Thank you very much, Donna. And I'll just make a general comment that as I'm monitoring the chat room, lots of positive feedback here. Of course, timely information that our membership's very interested in, and compliments on the presentation. So thank you very much. Another question that we have in here, one of our members has a friend that works at the Social Security office, and she had heard that the Social Security office will not open again for quite some time, potentially through next year. The sites could become vaccine centers. First, is that accurate news? And then a related question was, well, from the same individual, as far as guidelines for Halloween, is anything going to be provided? This seemed like a high-risk activity.
Yeah, I'll take the Halloween part first. What was the first question?
Yep, first question was in regards to Social Security offices that might not open and might become vaccine centers.
Right. Well, Halloween, there is some general guidance from the governor's office that came out. It's very general. It talks about not having parties like community center parties. It does say that Beggar's Night, trick or treat, traditional walking from home to home is acceptable. However, they have ideas and they're like, leave your candy out on the front porch, stay 6 feet apart, or create what is known as a candy shoot. You take a piece of PVC and shoot the candy to the kids. I guess you put it in the chute and it flies down the steps to the kids.
Oh, fun.
Yeah, I was like, what?
That's interesting.
There's a new candy chute they've created. So yeah, but the bottom line is that you stay with your bubble members, your family members. You don't walk in large crowds. It's probably safe to pick up that candy. There are those that encourage you let it sit for 24 hours before you start playing with it and touching it and stuff. But the bottom line is it will be one-on-one activities, and avoid those large community partners. You know, those packs of people that walk around the neighborhoods. Now, in regards to Social Security offices, there's any number of plans that are being kicked around right now in regards to what vaccine looks like. You know, a lot of the testing was privatized. It went to Rite Aid, CVS. They're doing the self-swab in the drive-through lanes. There is some expectation they will also be doing some vaccine. You know, pharmacists can vaccinate 7 and above. So that would be fine. We are hopeful that we can get some of that as well. Some vaccine. We always get the VFC vaccine, which is the free vaccine we can give to individuals without income or without anything, sort of health insurance. But we've purchased some vaccine as well to give to individuals. We're hoping to partner. We are hoping that hospitals are given adequate supplies of vaccine, and private physicians. We're really hoping those two groups don't get overlooked, because a lot of patients still use that as their, you know, their primary medical home, which they should be. And we feel as though they got left out of testing, and we don't like that. And we would rather they have some vaccine to be able to distribute as well. And so, yeah, but there's pods. They could be planning on maybe using those buildings. I can tell you local health departments are set up in order to do, we have vaccine portable refrigerators. We are set up to vaccinate anywhere. So we did that during H1N1. You may remember we were at the Chapel of Green, the Chapel in Hudson. So we can as well take the show on the road. So yeah, it just really depends on what the federal government final plan comes down. And then there's also something called a closed pod. So if you're like an Amazon or a Gojo or like a hospital system, the vaccine can be sent directly to you, and then you can just vaccinate your own people, which is often what happens in a closed pod.
Okay. Donna, thank you very much. And I'll mention here too, a couple other comments trickling in about the quality of the presentation. Just really appreciate it. Got a string of questions here, and I will state, Donna, we stay on until 1:15. That might have already been mentioned as a club, and keep the line open. So if you have to go hard stop at 1, that's perfectly fine. But we do have a lot of interest and questions here if you're able to stay on. And
I am. That's fine, honey. Don't worry. Yeah.
Perfect. So we've also got, so I'm trying to find that question here, part of my scroll. Okay. Dr. Rob wants to encourage everyone to get their flu shots anyhow. So I will make that PSA on his behalf, get your flu shots anyway. Couple of questions. Do we have any quarantining facilities for those in the crowded housing? And I'll also mention there was another question in regards to resources Summit County has for contact tracing.
Yeah, we have contact tracers. I have to tell you, before COVID-19 hit, public health has done contact tracing for years. We've always seen it as a very quiet, discreet activity that we did, very respectful of the persons involved. And it's typically been done around HIV and tuberculosis. When COVID-19 hit, contact tracing became a profession, which has sort of been interesting. We get lots of folks who want to come contact trace for us, but the bottom line is our contact tracing is done every day, and it's an attempt to do disease control. And it's really an attempt to try to put the individuals that perhaps could become ill on a quarantine period and stay away from those people that are ill and in isolation, so that you can spread the control of disease. So yes, we have plenty of resources. Now, when you talk about quarantining facilities for those living in crowded housing, I would assume you're meaning like maybe a jail or a house that's got too many people living in it. And the answer is yes. We can separate individuals out of homes. I have to tell you, for TB patients, we have paid for more than one hotel room in order to keep them separate from their families and from other folks. We have recently run into a couple situations in some community-based correctional facilities where we have actually put individuals out of those facilities into hotel rooms. And they're the kind of hotels that each have the individual units, so that there's not this big air conditioning system, but rather they're in these individual units.
Well, thank you, Donna. And hold on real quick. I want you to continue that thought, but I'm looking at the time here. If we can pause right there. I know we've been, Dr. Rob wants to make sure we get the lotto in and adjourn, and then can continue on. So I'm sorry to cut you mid-train.
Oh, it's okay, honey.
I just wanted to pause real quick.
That's okay.
Okay, Dave Hall, could you step in for
Absolutely. Yeah, so we had 9 players for 35 entries, and the winning number is number 4, who is Richard Fry. So congratulations, Richard. And I'm looking for Richard on here. Did he leave? Is that why he's the winner?
Oh, I'm still here.
All right, Richard, excellent. Give me a number between 1 and 32.
15.
13, 14, and 15 is not the wild card. So no progressive pot winner, but you did win the daily. So we'll get that out to you once we collect.
Great. Thank you, David. I just want to remind everybody to stay tuned, because Donna's graciously agreed to stay on to look at some of our other questions and concerns. Next week's speaker is our very own past president, Pat O'Neill. He'll be interviewing some of our former presidents for lessons learned in the years when we could meet virtually. So hopefully he'll give us some other creative ideas as lessons when they didn't have to meet virtually so we can take that and see if there's a way we can tweak it into our new virtual reality. So I'm going to turn the camera around so you see my bell and officially adjourn the meeting.
All right.
Thank you, everybody, but please stay on if you can.
Yes. Thank you, Dr. Rob. And for those that have been on in the post-meeting session, if I can better see the screen now. So if you have a question that hasn't been typed in, raise your hand here too. Feel free to, or use the box. But Donna, I want you to be able to continue your train of thought. Another question trickled in regards to vaccines that are being developed that require a 70-degree freezer, and if the county has that capacity. That was another question that had come in as well.
Yes, we do. We have one of those sub-minus 80-degree freezers that holds tons of vaccine. Yeah, that's been some of the difficulty in the planning. We have heard very different we've heard that it will come, having to be kept cold -70. We've heard it'll come has to be frozen, thawed, and used within a certain amount of time. We have heard that it will take 2 shots. We have heard that it will come in other forms as well, much like many of you might remember the polio vaccine was a liquid you drank when you were youngsters. So it might come in that form as well. But we do have the freezer ability to keep a -70, which I have to tell you, a lot of the test kits came in a frozen medium, and it is another layer of problem because you have to keep it cold and you have to make sure that you use it appropriately. So yeah, we've had a lot of this stuff is difficult, but we work with it.
Yeah, great. And yes, I guess a -70. I said 70-degree. I was like, what kind of freezer is a 70-degree freezer?
I can tell you.
The question was -70.
Yeah, we keep ice packs in it, and I made the tragic mistake of grabbing one day.
Oh my goodness.
Don't touch it. Yeah, don't
burning your hands. Yeah. Yes, not a good idea. I can imagine. Just another comment had trickled in as well, Donna. Just Chris Richardson thanking you for your leadership. It's much appreciated.
Thank you, Chris.
Terry Dalton, question just came in. How has the pandemic impacted other SCPH initiatives?
Well, we have something called continuity of operations. And so when a pandemic hits, obviously we shift some of our staff. And we've had to slow other programs down in order to accommodate the staffing needs in order to respond to a pandemic. We were fortunate that we have more staff than most health districts do across the state. We've been very fortunate here. And we've been able to have additional staff. So we weren't as impacted, but it has slowed down some of our other programs simply as it has with many of the, you can no longer do home visits for maternal child health. So everything is done by phone. Our EPA programs for air, we can no longer do some of the inspections we used to do for air quality. So we're required to do external air quality monitoring. So it's really changed the way we do business. We've had some employees working from home. We've had to do things like set up for birth and death records. We have a curbside service just because some folks don't feel comfortable coming into the building. Yeah, I have to laugh. People are like, no, I'm not going to. Everybody thinks we have COVID here. Probably we are the most COVID free because everything has been bleached, sanitized, and there's hardly anybody in here ever. But yeah, so we have had to, it's clearly impacted our programs and our way we operate.
I can imagine so. And Terry, thanks you for that question, or for that response. We've got a couple other comments, questions that came in, and Jack Herrig has his hand up actually. So Jack.
Donna, I have something that I came across just in the last couple of days. I don't know if you can see it.
Quarantine.
Yeah, it says quarantine.
Yes, it is a book from the rules and regulations and instructions from the Health Department, Akron. There's no date on it, but MD Ailes was the director, and it covers diphtheria, polio,
Mm-hmm.
and all of the historic diseases. If you would like to have that for your archives treasure, we'll see that it gets to you.
Oh, I would love that. That would be perfect. We have a few of them that actually say that there is we have a quarantine, like the placarding of homes. We have some of those. We would love to have that. That would be very generous. Thank you, sir.
It even has the changes in quarantine rules and regulations with the new state regulations. There's 5 or 6 of them.
That's why Jack's our club historian.
Oh, that's great.
Absolutely. Jack, thank you so much for that anecdote there. Yeah, I will say, Donna, you know, a few of our members, one in particular, just wants to, and I'll say her name, Cheryl Warren, personally invite you to consider becoming a member of our club, of course, and would love to talk with you more if you're open to learning more about
Yeah, I am.
who we
I
are
would
and
love
what we
that.
do. That's great. So
I
I'll make
love
sure
that you guys do happy bucks. I love that because
So,
we
yeah.
don't hear enough happy anymore.
That's one of the main reasons we do it. It's much needed, especially these days. And on that note too, how can we as a club, you know, regardless of whether or not you engage with us as a member, we've appreciated you coming here and would love to hear from you again. How can we help you and help the health department as a club? What are things that we as members can actionably do to provide benefits to you guys?
Well, I think just your willingness to listen to the facts, I think it's helping individuals realize that there's a lot of individuals that can make money during a pandemic, and some things it's always buyer beware. And I think that if you can be honest and model the behaviors we're trying to set forth, meaning that you wear a mask. I've told lots of parents that your children will behave like you behave. And if you set a good example for your kids are you. I mean, they want to be you. They want to be like you. And so good or bad, whatever you end up doing, that's how they behave. And so we beg parents to please try to set a good example for your kids. And I would ask everyone here as well. And then the other thing I would say is, in this crazy world, we have so much discord and so much distrust and so much anger, that if we can be the voice of reason and try to support each other and help each other, that's what we should do. We should really try to be with each other, and not judge each other, and really try to help, because no one knows what anybody else has to live with or go through. And people struggle, and particularly now their mental health is struggling. They're struggling financially. The world's been turned upside down. And what we do for each other is just as important.
That's a great message, Donna, and something that I think, pandemic or not, we should all take to heart and consider in our daily lives. And so thank you for that. I don't know if there's anyone else that has a question that hasn't been answered. I think I handled everything in the chat room. I don't see any other hands up. If someone has something else to say, please do share it now. But Donna, I will say, you know, we of course have these 15-minute after sessions ever since we went virtual. And once again, there's been a few where there's been more engagement than others. People are busy, and it's not necessarily because of quality of presentation, but this is definitely a session where we've had plenty of folks stay on. You had a great presentation, and I know there's a lot of interest. So we just thank you for your time. Thank you for being on here. And with that, I don't see any other questions that have come in. And so the line's going to be open for the next 7 or so minutes here. But with that being said, I don't think I see anything in the queue. So just a big thank you from our club. And